Hi, this is Dr. Carlos Mohammed here at Growing Smiles Children's Dental Center. Something I want to talk to you about today is once our child gets diagnosed with dental decay, what's next? What happens and what needs to be done? And do we really need to fix baby teeth? Now, one of the things that we need to first determine is the age and how many years that baby tooth has left in the mouth. There's times where if you're going to lose a tooth in the next year or so and it has decay, sometimes we don't need to address it right then and there. We can kind of put that off and allow it to exfoliate. In many situations, we want to preserve the tooth. We want to restore the tooth so that it continues to function both in chewing and speaking and in holding space. So teeth, even though they're baby teeth, are important. When we have dental decay on permanent teeth, well, we really don't have a choice. We need to address them because those teeth are permanent and they're going to last us a lifetime. We need to restore them before the dental decay or the damage becomes more extensive. I'm going to focus on our younger children, maybe 3 to an 8-year-old that needs dental decay treatment. We usually want to restore either using a white filling, and if the damage is too large, we may need to consider using a crown, which will cover the entire tooth. And we'll touch up on crowns in another session, and there's different options for crowns, different colors and materials. But I want to today touch up on behavior and what to expect from a 3-year-old or a 6-year-old when they are in the dental chair needing treatment. Most children in that age category are going to be fearful and have some anxiety because they have not been in this situation before. So there's times where we consider using nitrous oxide, commonly known as laughing gas. And that is something that is inhaled. The children wear a little mask where they inhale the nitrous oxide. That helps to reduce anxiety. It makes the child feel like the visit was shorter than what it actually was. And usually we're able to render some treatment in that manner. Other children need more invasive, more extensive dental work, and they're still young, so not only do we use the nitrous oxide, but we need to consider a sedation. A sedation is when we give children a medicine to drink. We only do oral sedations here at the office, so they drink a medication. We let the medication work for some time, and the goal of that medication is not to put the child to sleep, but to relax and provide to relax and get them more comfortable to be able to receive the dental treatment that is necessary at that time. Now, there are children that are not candidates for an oral sedation, whether they have restricted airway or they have other medical conditions that do not allow us to perform an oral sedation in the office. So in the rare case that that happens, or that your child needs extensive, even more extensive dental work and they're young, we need to sometimes consider our next option, which is general anesthesia. General anesthesia involves a child that's completely under anesthesia and allows us to render treatment. This is mostly focused on the younger children or children with special healthcare needs. But the most important thing is to come in for an evaluation so we can discuss it. There is no one formula that applies to everyone. Every child is an individual, and we need to tailor our options and treatment plan to what the parents want and what would be best for the child. Again, this is Dr. Carlos Mohammed here at Growing Smiles Children's Dental Center.